Good morning, viewers. I'm glad to be here once again. I'm called Mediatrix Bihira Byaruhanga. I work with Uganda Catholic Medical Bureau. This morning we are going to talk about sickle cell disease. And for listeners or viewers, sickle cell disease is a condition that I would actually call it a disorder of blood. If you have blood in your body and you get that kind of a problem that disorganizes your blood, then you get what we call sickle cell disease anemia. So everybody has got blood, and under normal circumstances, the blood should be normal. But when you get those genes that disorganize your blood, then you end up getting the sickle cell disease anemia. One might wonder, how does it come about? It's an inherited disease. So if I'm a mother and maybe I'm a carrier, chances are that I might pass the sickle cell disease to my child. So it's normally known as an inherited disease from parents. One might wonder why we are talking about sickle cell disease, because it's a very big problem in our country, Uganda. Uganda ranks as the 5th highest country in Africa with the sickle cell, well, it has both sickle cell traits and sickle cell disease. When we talk about sickle cell traits, we talk about people who have that gene that can cause sickle cell. You are a carrier, you don't suffer from the disease. But that accounts for 13% of Ugandans. So this is why you cannot sit back and don't mention it to our listeners. Then 15,000 of the children born in Uganda every year are sickle cell. They have sickle cell disease anemia. So this is why we really have to make sure that people get to know why it is a problem and how they can prevent it. Because if you get to a hospital, or if you get these children and you see the way it presents, you really don't want to have that kind of a child. So if parents pass it on to their child, how would they get to know that this child has got sickle cell? What we call signs and symptoms. A child who is a sickler, that's the one who is suffering from sickle cell, will have the following signs. But a child who is a carrier will not show any signs. And even parents that are carriers will not show signs, but chances are that 50% of the children you get. So if you are going to get about 4 children, 2 of them will be having sickle cell anemia. So how will you get to know that your children have got sickle cell anemia? They normally have pain in limbs. Like when you are trying to stretch a child, they scream a lot. They tend to have fever. And because from the word go we have called it sickle cell anemia, their blood is always less than normal. Because these disorders affect what we call the red blood cells in the body, which are responsible for producing what we call hemoglobin, or the amount of blood that one carries. So one of the signs is that the child will not have enough blood. They are sick, they have fever all the time, they are crying, what we call crisis. And this is normally triggered by fever, wind. So you have this child that is sick all the time. So this is why we really have to say, let's make sure that the parents get to know before they even plan to have children. And maybe one would ask, but if now you have anemia, what is going to be the treatment? So we've got what we call sickle cell centers in all hospitals, even in our Catholic hospitals in this country. You will go to outpatient. So once they have screened this child and they find out that the child has sickle cell, then they send you to a specialist. So the specialist will always treat these children according to the signs and symptoms they are presenting with. But most times actually they come with less blood, so they give them blood transfusion. So after blood transfusion, that is done when the children are admitted. If they have any other infections, because they are so weak and they are prone to several infections, they also treat them with antibiotics. Because we normally don't like to announce drugs on air, to avoid parents doing what we call self-medication. So it's better if you have this child and have got these signs and symptoms, we request you to go to a medical worker after they screen, they will definitely send you to the specialist who knows how to handle sickle cell. And it's not a must that every child will have sickle cell anemia. The others may even present with yellow eyes, what we call jaundice. And that means actually by the time a child is having yellow eyes, they pass yellow urine, that means even the liver is getting a problem. So this is why we don't want you to sit back. Most times people say our children are bewitched, we can use herbs, we can use that. We encourage you to take these children for screening. So one might wonder and say, how can I prevent this disease from happening? Ideally, since I've said that this disease is inherited, if people, before they start dating, because when you are dating, you are planning to get married. I work with HIV work, so most times we encourage people to go and have an HIV test. Please, when you are going for an HIV test, you also go for a sickle cell test. Because you can imagine if I said we are ranking as number 5 in Africa, which means most people are carriers and they don't know. So if you are not yet in a relationship, if you are planning to have a relationship, go with your partner and you test for sickle cell. If you test, maybe one of you is a carrier. There is nobody who is going to stop you from marrying, but they will give you, they say, we can't say that you do it at your own risk, but we shall tell you, one of you is a carrier and the chances of having a child that is a sickler is at 50%. And I said this, if you are planning to have 4 children and one of you as partners is a carrier, has that a sickle cell trait, then be rest assured that out of the 4 children you will get, 2 will have sickle cell. If you are planning to have 8 children, 4 will have sickle cell. So it's up to you to decide, should we go ahead and marry? So that's again back to you as a couple to decide. But for those who are already in a relationship, who didn't know, also when you are planning to have pregnant, to conceive as a woman, of course in antenatal, in our hospitals, in the biggest hospitals we screen for HIV, also screen for sickle cell anemia. So if we screen any pregnancy and we find that you are a carrier, we tell you, and we also encourage you to bring your husband. That's why you advocate for male involvement. So ladies out there, if you are pregnant and you are going for antenatal, your husband should escort you. So when you are going to be given antenatal package, one of the packages other than HIV screening, other than doing blood grouping, because they know you might need blood transfusion along the way, they also screen you for sickle cell. So if you get to know that one of you is a trait, then you are prepared, because there is a likelihood that this particular pregnancy you are going to get a child that is sickler, or the subsequent pregnancies. Then if also you didn't know and you have children, you can still take them for checking. I've said this, we screen for sickle cell. And you encourage, because sometimes when you have these children that already have sickle cell, I have seen it is still touches parents. They psychologically tortured, they are telling you we are always in the hospital. They even deny these children a chance of being immunized. And actually when you take these children for immunizations, I remember one of the signs I talked about was jaundice, the yellow coloration of the liver. So when you take these children for immunization, you minimize the chances of getting those bad infections. So don't say after all this child is a sickler and you deny them other rights of immunization. Last week Tuesday, I think I talked about malaria vaccination. If you have this child and is a sickler, take this child for vaccination, because actually when these sicklers, they are prone. When malaria comes, it hits them down. So once they are immunized, they are likely not to get issues. And also avoid self-medication, because I have seen mothers talk to their fellows, you have a sickler, you also have a sickler, this is the medicine they give me. The type of the medicine they give your child is not a must that every child will have. As I said earlier, every sign and symptom is managed. When you go for treatment, they always treat according to the signs and symptoms the child is presenting. I think that's what I can say about sickle cell disease. Thank you.